Hi everyone, can everyone hear me? Okay. Hi, I'm Aakriti, and I'm a second-year dental student at the University of Pittsburgh, and I'm here today to talk about the role of dental practitioners in recognizing abuse and supporting patients who are experiencing intimate partner violence or IPV. Before I start, I do want to say it's a bit of a sensitive topic, so if anyone has to step out for a moment, feel free to do so. So about 5 years ago, I started college at the University of Pittsburgh, and I had a really misguided amount of faith in my ability to wake up at 8 a.m. on a Monday. And that's what ended up putting me in a introduction to sociology class. And I still recall this class, even now, to this day, mostly for one reason, because I never took an 8 a.m. again, but also because it really shaped how I view dentistry now. So in this class, one of the things that we did was we played through a simulation called Spent. And the premise of it is that each player gets $1,000 to last them the entire month, to take care of rent, groceries, anything that comes up, essentially. And throughout the duration of the month, you'll face a bunch of different factors. So for example, one time your jaw is hurting, you're in a lot of pain, but you don't have insurance. So you decide, I'm not going to the dentist. You click, no, save the money. Immediately after, you'll get a notification that, well, actually 2 weeks later, it got so bad that you missed work, and now you get a deduction anyways out of your paycheck. So the goal is to make it through the month with as much money as possible, which is very hard to do. And when I started college, it was right after the COVID-19 pandemic. And so this was a pretty real situation for a lot of Americans and people around the world anyways. Especially more so when we had just learned in that class prior that the rate of domestic violence and IPV had significantly increased throughout the COVID-19 pandemic. So I realized that there was a lot of overlap between these situations in the scenario in the simulation, such as limited access to transportation or limited financial freedom, or even housing insecurity if someone decides to leave the situation. That rang true for people who are experiencing IPV in their day-to-day life. And so even though I was an undergraduate, I knew that I eventually wanted to go to dental school. And so I started to kind of think about how, as a dentist, I might be able to support these kinds of patients eventually later on, after many years of school. And a couple of Google searches later, and I found this really great program. It's called Give Back a Smile, if anyone's familiar with it. But the premise of the program is that they have dentists volunteer their time and their work to restore the smiles of people who have faced intimate partner violence or domestic violence and have had traumatic injuries to their smile line. And they do it for free. And so at the time, the program has been around since 1999, but I only found out about it, oh, that's my title slide, in 2021. And so they gave me some information about the program. And so this is a map of the distribution of volunteer dentists nationwide in Give Back a Smile, GBAS, in 2021. So as you can see, it's pretty popular in the East Coast, a little bit on the West Coast, and in the South. But when you zoom into Pennsylvania specifically, there's no one there. And this was really surprising to me because Pennsylvania is a huge state and a pretty hefty population as well. And there's kind of the same trend when it comes to patients who are applying to get this work done. This is a nationwide distribution in 2021. Again, very concentrated, East Coast, West Coast, and in the South. And in Pennsylvania, there's really no one applying for this. And so at the time, I was a little bit confused. I was 19, so I didn't really know much about how these things work. And at first, someone might wonder that it's just because there's not really a need for this kind of program in Pennsylvania. But that isn't true. So in 2021, there were 2,214 victims served in one day alone. And unfortunately, that number has only increased. So by 2023, we're looking at 3,102 victims in one day who are served. So there's obviously a need, and there is people who would benefit from this program. So at the time, I just thought the mission that I wanted to focus on was to just spread awareness about the project. So I started to just call shelters around Pittsburgh mostly because that's where I lived. And I kind of ran into a stalemate because I would call these shelters and I would tell them about the program and they would say, that's such a good idea, it's so awesome. And I would say, that's so great. How many people do you think are residing with you that might be interested in that? They would say, I have no idea. And I was like, oh, okay. And I kept hitting this roadblock over and over again. And I wasn't really sure how I could ask dentists to volunteer their time for a patient base that I wasn't really sure was going to exist at this point. And so at the same time that I was having trouble trying to find a way to promote the Give Back a Smile, their participation was also dwindling in Pennsylvania. So that as of February 2025, only 6 patients in the entire state have applied for services, and there's only actually 1 volunteer dentist in the entire state of Pennsylvania who's active in the last year for this. And so when I entered dental school last year, I had this project in the back of my mind, but between waxing lab and oral tissues, I wasn't really sure how I was going to reconcile with this at all. But luckily, that's when Helen came to speak to us at our school, and I reached out to her to ask if PCOH had any specific information about the need for dental care for IPV survivors or intimate partner violence survivors. And although our meeting did not answer all of the questions that I had at first, it did raise a lot of questions that I didn't think of before. And one of those was, well, what are we doing right now as dentists when the patient's in the chair? Before they're at the shelter or reaching them there, what are we doing when they come in and they're experiencing this? And so I learned that at Pitt Dental Medicine, we do screen for abuse. And so this is a screenshot of our Axiom simulation. So this is a questionnaire. It has a bunch of questions, and one of these is for screening for abuse when a patient first comes in. And so I'll just read it out very quickly. It says, does your current or former partner make you feel unsafe? And in the past year, have you felt controlled and unable to come and go as you please? Or have you been hit, shoved, punched, kicked, and otherwise hurt? And so at Pitt Dental, what we do is we use the AVDR approach. And so that's ask, validate, document, refer. And so we ask this question, and if the patient does say yes, the next step is to validate their disclosure and facilitate an empathetic response and make sure that they're comfortable in the environment. After that, we document. So what we do is we put everything that the patient said in direct quotes in their chart in Axiom, and then so that there's evidence of their disclosure. And then the last step is refer. So that's when what will pop up on our screen is what you see up here, and it'll have the resources of did you tell the patient that they can contact these hotlines for help to get out of the situation. And while this is a really important point to make sure that we are able to get patients to disclose and we're recording the evidence of it, I realized as a student that this wasn't, that as students, we were kind of having a hard time even asking the question. So we started doing head and neck exams on each other, and we started doing these screening simulations with each other before we start clinic in our third year. And I realized that no matter who my partner was, whenever we got to this question, it was so awkward. Like every time we got here, everyone would mumble the question or just skim through really fast. And it kind of made me wonder how we can expect patients to disclose to us when we're uncomfortable even asking the question. And a lot of my peers, including myself before I researched this, didn't even really know what our role was in this entire process. Like, we're asking, but then why exactly are we the ones who are going to ask, and what are we going to do with that information, maybe? And so as it turns out, it's actually really important that dentists play a role in this. And that's because there's different ways that intimate partner violence, or IPV, can manifest orally. And a lot of it is because a lot of that abuse can manifest in the head and neck region, which is what we're trained to look at. So the first way would be through recognizing direct signs of IPV through head and neck injuries. Secondly, it would be through the possible associations between stress-related oral disorders and the experience of IPV. And the last one would be because a poor oral hygiene is linked to a trauma history, and if someone's experiencing trauma and abuse, it could lead to an increased likelihood of cavities and gum disease. So just to go into a little bit more about this, there is research that is kind of focusing on what I'm talking about a little bit. So a lot of times in a situation of IPV or abuse, a lot of the physical abuse can look like punching someone in the face, in the jaw, or slamming their head against a wall, and that would be directly up here in the area that your dentist looks at. And so there's different studies, and they're all referenced below, but one of them found that oromaxillofacial trauma actually accounted for 51% of all injuries in IPV survivors. A second study found that 75% of that head and neck trauma that happens is actually associated with and occurs with oral injury. So it's not just like someone's nose is broken, but it's like someone's nose is broken and something else is happening in their mouth. Now they're missing a tooth, something like that. And then the last study found that patients with a head, neck, and facial injury were 11.8 times more likely to be victims of domestic violence compared to patients with other types of injuries. And so what this research is kind of suggesting is that as dentists, we're supposed to be experts in the head and neck area, and that's where a lot of the physical abuse can manifest. And if anyone should be able to tell the difference between a tooth being chipped because you bit into an apple really hard, or a tooth being chipped because someone slammed your face against the wall, it would be us. And so that's where dentists can play a really key role. So another way would be through stress-related oral manifestations. So not everyone might not be familiar with this, but your temporomandibular joint, it's like your joint over here. And so a lot of times you'll hear about people talk about TMJ pain and temporomandibular disorder symptoms. And the etiology, or like the cause of it, is not very well understood, but it is associated with stress. And stress and, as you can imagine, abuse go hand in hand. So one study found that 69% of patients experiencing orofacial pain also had a history of abuse. And that same study found that there was a positive relationship between the number of symptoms they had and the number of violence forms they experienced. So, for example, this could look like really bad jaw pain, or you can't open your mouth all the way or close it all the way, or even really bad headaches as your symptoms. And you're more likely to have those if you were physically and sexually abused versus if you were just physically abused. And then another study found that TMD was 1.45 times more likely in women who've experienced IPV. And so what I'm trying to say with this is not that everyone who comes in with TMJ is going to be a victim of abuse, but it is, since it is such a complicated and not well understood disorder, it might be worth keeping in the back of your mind, especially if a patient comes in and you think they also are experiencing abuse because of other things. So it might just be worth keeping in the back of your mind as a possible reason why. And then the last one would be poor oral hygiene. So this could be because of a lot of things. One big one would be the limited access to care. So a lot of times, people who are in an IPV situation don't have access to their own car, they don't have their own money, or they're just, in general, very isolated from anybody else. And another big fact is depression. So as you can imagine, a lot of IPV victims are depressed, and depression itself is linked to an increased likelihood of having cavities and gum disease and diminished salivary flow, which is protective for you. And so in this scenario, especially in the case of IPV, a lot of the situation in IPV is manipulation, and the power dynamic is very based on destroying someone's self-worth. So someone who is maybe experiencing IPV doesn't really want to go to the bathroom and smile and look at what they're seeing and have the motivation to brush their teeth. And a separate study also found that the exposure to domestic violence is associated with an increased risk of developing gum or periodontal disease. And so cavities and gum disease, I'm sure as we all know, are very common. So that's not to say that if someone has cavities and gum disease, they're definitely experiencing some kind of abuse. It's a multifactorial process. But as dentists, maybe when we're treatment planning and we can't figure out why a patient is having certain issues when they have a good oral hygiene, when they're not on any medications that are causing gum disease, that should be causing gum disease. Again, if someone comes in and they're kind of showing other signs of potential abuse, it's something to keep in the back of your mind. So this is kind of how, when someone comes into our chair, we can kind of see maybe there's some manifestations possibly of abuse, but at the same time, there are certain ways that we might be unknowingly triggering these victims ourselves. So the first one would be having them recline in the dental chair and placing the napkin around their neck. So you could probably ask anybody and they'll say, yeah, it's kind of vulnerable when I have to go all the way back like that. But especially for people who've been in situations of IPV, this is pretty vulnerable because a lot of assaults occur this way. And also specifically for people who've experienced a choking assault, having the napkin just placed around their neck when they're not really paying attention is triggering for them and can re-traumatize them. The second thing that might be happening is, obviously, we're using a lot of sharp instruments when we're working on a patient, and in the case of a lot of assaults and domestic violence and intimate partner violence, a lot of those might have occurred with threats with like a knife or a box cutter. And then the last way would be having our patients keep their mouth open for a prolonged period of time while they're unable to really see or communicate with anyone in the room. And so in the case of sexual assault and sexual violence, a big part of that is keeping your mouth open for a prolonged period of time. And this can be one of the ways that we might be re-triggering our patients, especially given that they can't really communicate or see behind them. It's usually not just you in the room, it's us, and then we have a hygienist, or it's us, we have an assistant. People are coming in and coming out, and they can't really see anything. So that can lead to them feeling really vulnerable and kind of defenseless. But obviously, we can't just stop doing these things. As dentists, we want to provide the best care possible, and that does require doing these three things. But there are small ways we can change things, especially if you have someone who's come into your office who's already disclosed that they've been a victim in the past of IPV. So for example, this could be as small as asking the patient to put the napkin around their own neck, or a lot of dentists already do this where they'll say, you know, if you need a break, just raise your hand and I'll stop. And this kind of gives them more autonomy over the situation. So kind of along those lines, these are a couple strategies to increase patient comfort. So the first would be to change your surroundings so the patient has privacy to disclose if they want to do that. A lot of dental offices are set up for efficiency, so you have a lot of operatories right next to each other, really thin walls, people just like coming in and out. So if someone is maybe thinking of disclosing, they're probably not going to do it in that environment. So if you're taking someone's medical history and they're kind of acting a little finicky around the abuse question, you might think of maybe taking them to your office or a conference room so they have more privacy. So if they want to disclose, they will do so. The second thing is to practice culturally competent care. So disclosures don't look the same for everyone. Someone might come out and just say, yes, I'm being abused, I'm in danger. But it also is different, and it can vary based on cultures. So for example, in the Inuit community, if someone says, oh, he's acting funny is like a term that they use to describe abuse. Or in some Latino communities, disrespecting you is also a separate way to describe abuse. So that's just something to keep in mind, that just because someone isn't maybe coming out and saying, yes, I'm being abused, which they might, but they also might not, and they might say it a bit differently. And then the last thing would be to understand there's different types of barriers to disclosing. So we never want to push a patient to disclose. Even if we think that they're in danger and they could need help, it's at the end of the day their decision, and forcing them to disclose would be stripping them of the very little autonomy that they already have in their situation. So that's also something to keep in mind. So a couple of next steps. You can have different steps depending on your involvement, I guess. So at the school, one thing that I was thinking about is that at Pitt Dental Medicine, we have these things called standardized patient sessions. And so what they are is we have actors come in and play a role. For example, we have it for smoking cessation. So they're a huge smoker, and you're trying to offer them resources to quit if they're interested in doing that. Similarly, schools could do that with actors or actresses playing intimate partner violence survivors who are maybe experiencing abuse. They come in, and the student has to learn how to navigate that. So before they go to clinic, if that does happen, they're better equipped for that. The second way is at the practitioner level. So you could do those day-to-day changes I already talked about, like asking the patient to place the napkin around their own neck. But also for anybody else who wants to get more involved, I put the Give Back a Smile QR code up there if anyone wants more information about that or wants to join and volunteer their time. And then the final way is at the community level. And so it's really important that everybody is aware of the importance of screening for this kind of abuse in your office. It's not necessarily the fact that someone's going to disclose to you. It might be your hygienist, it might be your receptionist. So just making sure that everyone's on the same page of how to handle that. Also, I've been working with PCOH and the PA Coalition Against Rape to make these brochures, one for patients, one for providers. So the provider one kind of summarizes what I've already talked about with trauma-informed care and oral manifestations of IPV. And then the patient one kind of has templates for patients to figure out if they're interested in disclosing a template for how they can bring it up to their provider, or just resources in general for them if they're not comfortable doing that yet. So that's all I have. Thank you guys so much for your time. And this is my contact information on the side if anybody has any questions or wants to reach out about anything. Thank you.